Today we will see regarding the some anatomy of the neck and the neck swelling. The neck swellings. This is the gross anatomy of the neck. The sternocleidomastoid muscle having two heads. This is sternal head and clavicular head is seen at the lower end. That is the sternocleidomastoid muscle. Then submandibular triangle, carotid triangle, then posterior triangle is seen. Then posteriorly there is a trapezius muscle, and in between omohyoid muscle is seen. Below clavicle and manubrium sterna is seen. So this is again a part of anatomy. Carotid sinus, carotid artery is seen, internal jugular vein is seen, then the clavicular and sternal head of the sternocleidomastoid muscle. Then again this is another picture of neck anatomy. This is the submandibular triangle, head bone, thyroid and cricoid cartilage, then jugular notch, then sternocleidomastoid muscle, then sternal head, clavicular head, and trapezius muscle is seen, supraclavicular fossa, then clavicle, intraclavicular fossa. Then so this is the gross anatomy of neck is seen. Neck being so the common neck swellings are divided into the midline swellings and lateral swellings. The midline swellings starting from above, middle and below. Inflammatory swelling, Ludwig's angina, enlarged submental lymph node, sublingual dermoid, lipoma in the submental region, thyroglossal cyst and suboid bursitis, goiter of the thyroid, isthmus and pyramidal lobe, enlarged lymph node and lipoma in the suprasternal space of a burns. Then retrosternal goiter and thymic swelling, and the dermoid swelling, dermoid cyst anywhere in the midline. These are the midline swellings. Then what are the lateral swellings? Lateral swellings are divided again into submandibular triangle swellings, then carotid triangle swellings and posterior triangle swellings. The submandibular triangle swellings are lunging ranula, extension growth from the jaw, and any enlarged submandibular salivary gland or lymph node. Those are the submandibular triangle swelling. Then carotid triangle swellings are carotid artery aneurysm, carotid body tumor, branchial cyst, bronchogenic carcinoma. Then thyroid swelling will be deep to sternocleidomastoid, and sternocleidomastoid tumor may develop in a newborn baby. Then what are the swellings from the posterior triangle? Enlarged lymph node, then there may be a cystic hygroma, pharyngeal pouch, subclavian artery aneurysm, aberrant thyroid would be there, then cervical rib and the lipoma, that is Dermid's disease. These are the lateral swellings. For the clinically, the swellings are divided into the acute swellings and chronic swellings. What are the acute swellings? As we have seen, the Ludwig's angina, cellulitis, including Ludwig's angina, boils, carbuncle, acute lymphadenitis. Then what are the chronic swellings? Chronic swellings are divided into the cystic swelling, solid swellings and pulsatile swelling. The cystic swellings are bronchial cyst, thyroglossal cyst, dermoid cyst and cystic hygroma, sebaceous cyst, and adenoma of a thyroid gland and cold abscess. These are the cystic swelling in the neck. Then what are the solid swellings? Solid swellings arising from the thyroid, bronchogenic carcinoma and sternocleidomastoid tumor. What are the pulsatile swellings? Pulsatile swellings are aneurysm of a carotid artery or subclavian artery, carotid body tumor, lymph node uh, swellings lying over the close proximity of the artery, carotid or subclavian artery. Then in a few primary toxic goiter, there could be a pulsations. So these are the clinically acute and chronic. Then depending upon the this triangle lateral swellings, then midline swellings we have seen. Then there could be a the swellings could be a congenital swellings, inflammatory swelling, or neoplastic swellings. The congenital swellings are sebaceous cyst, branchial cyst, thyroglossal cyst, lymphangioma or hemangioma, dermoid cyst, ectopic thyroid tissue, laryngocele or pharyngeal diverticulum, and thymic cyst. What are the inflammatory swellings? Then all lymphadenitis could be a bacterial, viral or granule matter. Then chronic inflammation, tubercular swelling, cat scratch, sarcoidosis or fungal, then adenitis, parotid or submaxillary, then congenital cyst and frost granuloma. What are the neoplastic swellings? The metastatic unknown primary or epidermoid carcinoma, primary head and neck epidermoid carcinoma or melanoma, adenocarcinoma, thyroid, lymphoma, salivary, lipoma, angioma, carotid body tumor or rhabdomyosarcoma. Thyroglossal cyst is a congenital swelling, but it may arise any time during the childhood. The site could be a subhyoid thyroglossal cyst, suprahyoid thyroglossal cyst. It could be in the near to the thyroid cartilage, or thyroglossal cyst could be near cricoid cartilage also. So these are the positions of the thyroglossal cyst. The cyst usually small and contain two tails or exhibit different fluctuation, can't be felt. The swelling moves with the protrusion of a tongue and during deglutition, during swallowing. So thyroglossal cyst moves with the swallowing and moves with the protrusion of a tongue, but the thyroid swelling will not move with the protrusion of a tongue. That is a differentiating point between the thyroglossal cyst and the thyroid swelling. So this is the most common congenital swelling. 50% present before the 20 years. 75% cases it is midline swelling, and 25% it is near to midline. And as we have seen, it moves with the swelling and protrusion of a tongue. Thyroglossal cyst may get infected or rupture and forms a discharging sinus. Rarely it may be only functioning thyroid in the body and may give rise to thyroglossal fistula. These are the complications of the thyroglossal cyst: infection, fistula formation. Then how it is diagnosed? It is diagnosed clinically with the fluctuation in the site. It is diagnosed on ultrasonography of a neck. What is the treatment? Treatment is a cyst trunk operation, removal of the thyroglossal cyst, or if it is a passing to the hyoid bone, the hyoid bone may have to be cut. That is a cyst trunk operation. Then branchial cyst. It comes in lateral neck swelling and congenital swellings, but it appears not before adolescence and early adult life. Commonest way of presentation is the cystic swelling in the upper part of the neck. Half will be in front and half will be deep to the sternocleidomastoid muscle. The cyst become inflamed and confuses to the clinician for the other inflammatory swellings. The diagnosis is confirmed with contains cholesterol crystal. So it is a cystic swelling anterior to the sternocleidomastoid below the mandible, and it is the persistence of the second branchial cleft, usually lined by squamous epithelium, and contains thick turbid fluid which contain cholesterol crystal. Present in the upper neck in early or adulthood at the upper and middle third junction. The fluctuation and translocation test is positive, may get infected, is diagnosed on binodal aspiration biopsy or ultrasonography. Treatment is by excision of brachial cyst. This is a operative picture of a excision of a brachial cyst. Then what is ranula? Ranula is a swelling at the floor of the mouth. It is a cystic swelling. The floor of the mouth looks like a little frog. It is a mucus extravasation from the sublingual salivary gland. It may extend through the floor of the mouth into the muscle in the neck, and it is called as a plunging ranula. The treatment is excision of a ranula.
We'll soon see the lymph nodes in the cervical region. What are the levels? There are 7 levels of lymph node in the neck. The level 1 is a submental plus submandibular group of lymph node. Level 2 is a upper deep cervical group of lymph node. Level 3 is a middle deep cervical lymph node, and level 4 is lower deep cervical lymph nodes, that is along the sternocleidomastoid muscle. Level 5 is a spinal accessory plus transverse cervical group of lymph node. Then level 6 is a pretracheal, paratracheal or prelaryngeal group of lymph node. Then level 7 is a upper mediastinal group of lymph node. What are anatomic division? The deep lateral cervical group of lymph node, deep cervical chain, spinal accessory chain, and transverse cervical chain, and anterior cervical group of lymph node. Pretracheal, paratracheal, prelaryngeal, submental, submandibular, parotid group of lymph node, and retropharyngeal group of. The deep cervical chain of a lymph node along the internal jugular vein within the carotid sheath includes jugulodigastric and virtuous group of lymph node, divided into the high deep cervical node above the level of hyoid, mid deep cervical between the hyoid and cricoid, and low deep cervical below the cricoid cartilage. Receives the parotid, retropharyngeal plus submandibular nodes, common pathway for the upper digestive tract plus airway. Drains subclavian internal jugular via jugular lymphatics. The spinal accessory chain for deep lateral along the spinal accessory nerve receives the occipital, mastoid, scalp, lateral neck, shoulder lymphatics. Drains into the transverse cervical chain and nasopharynx. The transverse cervical chain, deep lateral group of lymph node parallel to the clavicle receives spinal accessory chain, deep cervical chain, subclavicular node, anterior chest wall, and anterior lateral neck. Drains subclavian internal jugular via jugular lymphatics. Pretracheal, anterior cervical along the external jugular vein external to the strap muscle receives the lymphatics, the skin and muscles of the anterior neck, and drains thoracic duct and anterior mediastinal group of lymph node plus lowest deep cervical chain. Prelaryngeal anterior cervical subglottic involvement in a laryngeal malignancy. Paratracheal anterior cervical lateral to the trachea receives the supra plus subglottic laryngeal larynx, piriform sinus, thyroid, trachea, esophagus drains as per the peritracheal nodes. Submental between the anterior belly upper two digastric muscle receives from the chin, lip, cheek, floor of the mouth, anterior tongue drains submandibular nodes into the high deep cervical chain. The submandibular group of lymph node drains into extra glandular and adjacent to the submandibular gland and receives as above, drains into the high deep cervical group of node. Then parotid could be intraglandular or extraglandular, receives external auditory canal and eustachian tube and skin of the forehead, posterior cheek, buccal mucosa, gum and drain to deep cervical chain.
Retropharyngeal group of lymph node, medial and lateral retropharyngeal space at the level of naso and oropharynx, receives the naso and oropharynx, drains into high deep cervical chain. Cystic hygroma. Cystic hygroma, it is a type of congenital lymphangioma. Commonest victim are infant and children. The lymphangioma is a result of abnormal collection of the lymph channel in the body. The sequestration of a jugular lymph sac from the lymphatic system account for it. The large extensive collection of these are known as lymphangioma or cystic hygroma. Usually as we have told, it usually manifests in neonate or early infants. This cyst can involve the neck, oral cavity, face or airway. It may extend into the chest or mediastinum. It is a cystic and brilliantly translucent swelling. It may extend its pseudopod into the deep muscle down to the mediastinum or pectoral region. Mediastinal extension may be suspected when impulse on coughing is positive. When the patient cries, the child cries, the impulse is seen or the swelling become tense. So that is a mediastinal extension can be seen. Swelling it is multilocular or unilocular. Unilocular swelling in the neck is called as hydrocele of the neck. Sometimes the swelling may be present in breast. That time it is called as hydrocele of a breast. It may get infected with the infection of a nasopharynx. The may present in axilla, groin, mediastinum, muscle. It may obstruct the labor also. Occurs in the lower third of neck and in the posterior triangle is a commonest site. The soft and compressible swelling and brilliantly transluminant swelling as we have seen. The cheek, mediastinum, axilla, groin are the other side of presentation. How it is diagnosed? It is diagnosed with the medical resonance imaging is imaging that gives the best information regarding the extent and location of the cystic hygroma. X-ray and CT scan may also give the help fully realize the extent of the swelling. And before all these things, the ultrasonography of neck can give the idea of this extension of this cystic hygroma. And what is the treatment? The treatment is by excision. What is hemangioma? Hemangioma is an abnormal growth of a blood vessel that are formed before or shortly after the birth. These are the vascular malformations or hematomas may arise from the capillary vein or arteries. When it arises from the capillary, it is called as capillary hemangioma. When it arises from the vein, it is called as cavernous hemangioma. When arises from the artery, it is called as plexiform or cirrhoid hemangioma. So it can be a small pinpoint, or it may grow to quite large size. Hemangioma may look like a small red pimple on the skin, and large bulging bluish red masses protruding from the forehead, eyelid, or soft compressible bluish mass in the neck. Hemangioma usually start to grow uh, larger shortly after the birth, that is a proliferative state, reaching a peak at 18 months to 2 years of age. At that point, most of the hemangioma will start to shrink. This process may take several years. Diagnosis of hemangioma can be done with the ultrasonography of that part, if it is over the lip, over the tongue, forehead, or wheresoever it may present, it can be done with the ultrasonography. The another investigation is MRI, magnetic resonance imaging, is used to diagnose the hemangioma. Sometimes the biopsy of that lesion can be taken to confirm the diagnosis. What is the treatment? The treatment of a hemangioma. If the hemangioma are located in areas that causes the patient breathing problem in the airway, or the problem of seeing, if it covers over the eyes, steroid may be given to shrink the mass. However, the steroid only give the temporary relief, and therefore need to be given over the long period of a time. In addition, this form of a treatment has its own risk due to side effects of the steroid. If the steroids are not advised, then the surgical treatment is alternative to reduce the size of the hemangioma more permanently. The surgical therapy using the laser has been very helpful in shrinking or excising the hemangioma. Both the CO2 laser or carbon dioxide laser and YAG laser are used. What is a dermoid cyst? The dermoid cyst is a mass containing the skin, hair, and skin glands that are trapped under the skin, usually located in the line drawn from the midline of a forehead to the bottom of neck. The congenital dermoid cyst located on the scalp, face, in the nose, or in the neck. The dermoid cyst is recognized as a small painless swelling on the face, scalp, nose, and neck. They can ranges in the size from 1 to 4 centimeters. Sometimes the imaging studies such as a CT scan, MRI are needed, or the ultrasonography is a commonest investigation is done. CT scan are also used to look for any part of the dermoid cyst that may extend into the skull bone. The dermoid cyst need to be surgically removed. This is usually simple surgical procedure. What is inflammatory swellings like Ludwig's angina described by the Ludwig? It is a browny swelling of a submandibular region. Virulent streptococcal infection and anaerobic organisms are the causative organism. Gives rise to dysphagia, obstruction to the ear. Infection can spread deep to facial layers to involve the larynx, causing the glottic edema. Antibiotic. What is the treatment? Antibiotic therapy by intravenous route is a treatment. Submental, if the abscess is formed, then the submental incision is used to drain. The additional tracheostomy may sometimes be. Acute cervical lymphadenitis Affected lymph nodes are enlarged and tender. Additional feature including the fever, anorexia, malaise will be there. Antibiotic followed by drainage of abscess. It is a tubercular adenitis, the commonest cause of cervical lymphadenopathy, affect the children and adult. Deep upper cervical nodes mostly affected. Gain entry through the tonsil, both bovine and human forms. Forms polyester abscess followed by treated by the chemotherapy of that is antitubercular. The primary tumors of the neck, the neurogenic tumor, chemotechtoma, carotid body tumor. It is a rare tumor seen in high altitude dwellers. Chronic hypoxia leading to the hyperplasia. Present in a fifth decade. 10% patients show a family history. Slowly enlarging, long-standing painless mass. Firm, rubbery, pulsatile, mobile, side to side with the blood. The carotid angiogram and duplex scan gives the diagnosis. What is the treatment? Excision with the venous autograft. The vagal body tumor arises from the vagal paraganglionic tissue just below the base of skull at the jugular foramina. Slow growing, painless mass, anterolateral aspect of the neck. The CT scan, MRI and angiography are the diagnostic investigations. The treatment is the peripheral nerve tumor, schwannomas, solitary and encapsulated tumors. The vagus nerve is the commonest site. The neurofibroma is also arise from the multiple neurofibromatosis is autosomal dominant disease. Treatment is by excision. The secondary carcinoma of a neck, infiltration from the primary head neck like a nasopharynx, tonsil, tongue, pyriform fossa, supraglottic larynx, search always primary followed by the biopsy. FNAC, that is fine needle aspiration biopsy. Cytology is of an enlarged lymph node is done. The treatment along with the primary site either surgery or radiotherapy.